From nose cones to geysers. One thing the IDF is known for is multitasking. In the Israeli military, everybody has to learn to do multiple things at the same time. And that is just a matter of survival. Or take the IAF, the Israeli Air Force. The IAF has been described as going off-road from day one. A race car just doesn't work in such an environment. It needs a well-defined track to run on, or it's in trouble. Now apply that to an Israeli company called Animation Lab. It's a startup created by Erel Margalit. In creating the company, Margalit decided to draw on talent from the Betzalel Art Academy in Jerusalem, fostering a multitasking mentality. One artist from Betzalel, now working on animation design, managed to solve a complex technological problem because in the past he had been a pilot in the IAF, and that job had given him just the experience he needed in his new vocation. Think about it. Every IAF plane is a kind of jack of all trades. It carries its own onboard electronic warfare system. And each pilot learns not only his own target, but other targets as well. Now think about Animation Lab once again. In this film company, titles are interchangeable. And people aren't just stuck in one job description. They do more than one thing at a time. Now consider the American term, mashup. It originally came out of the recording industry, referring to merging two or more songs into one. But in Israel, it's come to mean the combination of radically different technologies and disciplines. One prime example is the implantable artificial pancreas. Meet the pill cam, developed by the Israeli company Given Imaging. This was the first company to go public on Wall Street after 9/11. What the pill cam does is to transmit images of the insides of a person's intestines. And believe it or not, it's an adaptation of technology from the nose cone of a missile. The capsule is equipped with a miniature video camera and light source. It travels painlessly through the entire digestive tract. It captures images quickly and sends them to a recording device worn during the procedure. We should also get acquainted with Compugen, a genetic sequencing company. The company president, Eli Mintz, the Chief Technology Officer, Simchon Feigler, and Software Chief Amir Natan met in the Talpiot program of the IDF. Mintz had previously created algorithms for sifting intelligence data. And Compugen chairman Martin Gerstel notes that Talpionim are master problem solvers. Eli Mintz partnered with Feigler and Natan to develop a more powerful computer. And in fact, the company's first computer, dubbed BioAccelerator, boasted speeds up to 1,000 times faster than other platforms being used at the time. In 1997, the company followed this success by introducing LEADS, an EST or expressed sequence tag, clustering an assembly platform used to identify gene transcripts and instrumental in gene discovery and gene sequence determination. By around 2001, Compugen had effected a shift in its business model from a company whose almost exclusive focus was marketing computer programs and applications to one whose operations extended into the diagnostics and therapeutics field. In 2005, a new business model was adopted, shifting to drug development. Call it predictive drug development. Instead of testing thousands of compounds, why not start at the genetic level? It's actually quite consistent with the classic Israeli lack of patience. Then consider a new kind of aspironics, an inhaler sized like a credit card, basically a breath-powered wind turbine. Enter Dan Adler, a professor at the Technion. His specialty? Designing gas turbines and jet engines. Enter also mashup champion Yossi Gross, specializing in aeronautical engineering, electronics, physics, flow, and hemodynamics. The new inhaler they pioneered was, pardon the pun, breathtaking.
It is long proven that absorption of drugs into the blood circulation is the most effective way of delivering many drugs. But do we need a needle injection for it? Do we need the side effects of pain and the risk of infection? Or do we need the bother of swallowing pill after pill? Aspironics is a medical device startup in the field of dry powder inhaler solutions, founded in 2007. These days, Aspironics is in the final stages of developing a breakthrough in drug delivery, a single-dose, disposable dry powder inhaler device. Our lungs provide a large absorptive surface area. While one of their principal functions is to transport oxygen from the atmosphere into the bloodstream, they can also become a way of administering drugs directly into it. Aspironics dry powder inhaler is an easy-to-store, easy-to-carry, and easy-to-use device. As easy as taking a breath. The airflow created by taking a breath activates the device and beats a spring with a mesh package on it, where the drug powder is stored. The beating effect causes fine powder particles to be released from the package. Synchronized with the patient's intake breath, it provides an accurate dose and high fine particle fraction every time. With production costs just a few cents for a disposable unit, all that remains is to remove the seal and inhale. No need to sterilize it for a second use. Aspironic's vision and potential is to become the industry standard for single-dose disposable inhalers. The research and management team behind this vision includes professionals with experience in life science company management and DPI expertise. Aspironics, pulmonary drug delivery through dry powder inhaler.
As for Israel's next miracle, consider Beta O2, a startup that developed an implantable bioreactor replacing the pancreas. It's all about creating a microenvironment, utilizing, of all things, algae from Yellowstone geysers and a light source. It's another Yossi Gross startup. The artificial pancreas is essentially an insulin bioreactor that contains islets of Langerhans, cells from pancreatic regions of the body that contain hormone-producing beta cells. The islands in the bioreactor replace the function of the endocrine part of the pancreas, i.e., the sensing of the level of glucose in the blood and the regulation of the production of insulin and glucagon as needed. Within the bioreactor, the cells are implanted into a hydrogel structure that provides a comfortable and viable environment for the cells to thrive. Furthermore, this structure provides protection from the body's immune system. This protection enables those with type 1 diabetes to avoid lifelong immunosuppressive therapy, an otherwise absolute must with the conventional islet transplantation. The Beta Air bioartificial pancreas is implanted in a minimally invasive procedure that takes less than an hour. Patients are hospitalized for several days thereafter for observation, and then discharged. Next, consider Transpharma Medical, which had to deal with the challenge of how to get large molecules or proteins through the skin without injection. The device developed uses radio frequency RF pulses, creating microchannels through the skin. A small device creates the microchannels, then a dry patch is applied. It's the first powder patch ever developed. Quite an accomplishment.
A microarray patch technology is being developed for the transdermal delivery of large molecule drugs without the use of injections. The patch is in a Band-Aid format, and the surface of the patch is structured with polymer microneedles from which the drug is delivered. The drugs can be attached to the external surface of the polymer microneedles, integrated into the polymer, or both. When the patch is applied, the microneedles cross the stratum corneum and penetrate into the epidermis. The microneedles do not penetrate deep enough to enter blood capillaries or nerves, hence the delivery is non-invasive and pain-free. The drugs for delivery are present in a nanostructured form, facilitating uptake into the body. The microneedles are made of a polymer that is biocompatible and biodegradable. This reduces the risk of trauma to the skin and infection. The microarray patches have been designed for the delivery of peptides, proteins, hormones, vaccines, and skin repair agents. The use of microarray patches will enable a wide range of medications to be effectively delivered to humans in a safe and non-invasive.
Bottom line, Israeli mashups are more than a curiosity. They're a cultural mark at the heart of innovation. They integrate multidisciplinary backgrounds. They combine military and civilian experience. They open new industries, and they bring about disruptive advances in technology, disruptive advances in technology. And in this case, disruptive is good. Basically, they're the ultimate form of free thinking. And that's the real deal. So let it be written. So let it be done.